So again, this is a really big decision, and it's really important to have these open conversations with your partner so you guys are both on the same page. And being sexually active is a matter of personal choice. There isn't a right age past the age of consent or a right time.
You pull out your and go to Mentimeter.com on your phones or on a separate tab. The code is right on the top here. And we want to see a nice word cloud formed of all the fun words that you can describe or that you want to see during this meeting.
What are some qualities that really inhibit a safe space for you? It can be one word, a sentence, anything that you have to contribute. We would highly appreciate the contribution. Let's see these words pile in. All right, we're already having some words come in, which is wonderful. We see non-judgmental and honesty. I completely agree. Respect, inclusivity, inclusion. More honesty, trust. I already like where this word wall is going. I love it. Now, Rima, I'm very curious. What does a safe space, what is some words that you feel when you hear the word safe space?
Absolutely non-judgmental, like a place where you can share anything openly without the fear of being judged. What about you, Gabby?
Yeah, I think there's also a really good form of humility in this, of just having to be able to see the humility in others and just make sure that you are at a point of understanding that there's vulnerability between everyone, and this is just a really good, and a safe space is a really good place to allow that feeling to be exhibited. And yeah, and there's so many more coming in. We have supportive, help. I see kindness. These are incredible words. Aisha, do you have a word that you can use for a safe space?
I think the one for me would just be like respect and open-mindedness. I think everyone has a different opinion, everyone has a different approach, and hearing everyone's opinions and just welcoming that without making them feel bad about the way they feel.
Awesome. Perfect.
Thank you so much for sharing, everybody. I think we can move on. One word that I really like on the screen is understanding. So thank you so much for sharing. I think we're good to go.
So let's get started.
Identity and attraction. Sexual health affects every single individual differently. So follow along with me. I'm going to go horizontally across. So first, gender identity. Gender identity is a person's internal and individual experience of gender. A person's gender identity may be the same as or different from their sex assigned at birth or biological sex. Gender expression is the way in which a person expresses their gender identity, typically through their appearance, dress, or behavior. Sexuality can refer to a person's capacity for sexual feelings, sexual activity, or sexual orientation. Sexual orientation is a person's identity in relation to the gender or genders to which they are sexually attracted. Attraction is the action or power of invoking interest, pleasure, or liking for someone. There are many different types of attraction: sexual, romantic, physical, intellectual, emotional, or aesthetic. Lastly, we have romantic orientation, which is usually left out. So romantic orientation is a person's identity based on a person's gender or genders to which they are romantically attracted, regardless of their sexual orientation.
All right, so next up, we're going to be talking a little bit about sexual behaviors. It's important to respect everybody's individual sexual orientation and whatever label they decide that they choose. Sexuality is a spectrum. It can be experienced and expressed through thoughts, fantasies, desires, beliefs, attitudes, behaviors, practices, roles, and relationships. Sexuality is fluid, and sometimes we may identify with other sexualities or orientations over the course of our lifetimes. And at the bottom, we have some of the examples for sexual attraction. So heterosexual is the attraction to the opposite sex or gender. Homosexual is the attraction to the same sex or gender. Bisexual is the attraction to more than one sex or gender. Asexual is no sexual attraction to any sex or gender. Polysexual is the attraction to people of various sexes and genders, but not necessarily all of them. Heteroflexible is primarily attraction to people and of the opposite gender or sex, and occasional attraction to people of the same gender or sex. And then finally, homoflexible primarily is the attraction to people of the same sex or gender, and occasional attraction to people with the opposite sex or gender.
Sexual behavior in men. So men who have sex with men, also known as MSM, may not necessarily identify as being gay, bisexual, or any specific sexual identity. Some men may be questioning or unsure of their sexuality or choose to dispense their sexual identification altogether. Engaging in sexual activity with a man does not necessarily mean you are gay. Men who have sex with men are at risk of STIs and HIV/AIDS. Many safe sex supplies are available for men, and practicing safe sex will drastically lower your risk. Some sexual practices for men who have sex with men may include oral stimulation, which includes fellatio or analingus, manual stimulation such as throating, or using sex toys. Sexual behavior in women. So this is women who have sex with women, also known as WSW, may not necessarily identify as being a lesbian, bisexual, or any specific sexual identity. Some women may be questioning or unsure of their sexuality or choose to dispense their sexual identification altogether. Engaging in sexual activity with a woman does not necessarily mean you are a lesbian. Even if a woman exclusively has sex with women, there is still a risk of exposure to STIs or HIV or AIDS. There are many safe sex supplies available for women who have sex with women. Some practices that women who have sex with women may engage in include oral stimulation, such as, I'm not going to try pronouncing that, that's a really long word, or analingus that I can pronounce, manual stimulation, such as fingering or rubbing, or using sex toys.
So healthy sexuality is understanding that sexuality is a natural part of life and involves more than just sexual behavior. It's recognizing and respecting the sexual rights that we all share, having access to appropriate sexual health information, education, and care, making an effort to prevent unattended pregnancies, STIs, and to seek care and treatment when needed. And the Student Health Center does provide treatment for STIs, so you can always call us and talk to our nurse, and we can help you. Being able to experience sexual pleasure, satisfaction, and intimacy and desire, and being able to communicate about sexual health with others, including sexual partners and healthcare providers. And just an important thing to know is having as STI or unwanted pregnancy, it doesn't prevent you from being or becoming sexually healthy at a later time. And then there's several different types of sexual contact. Some are erogenous touching, also known as foreplay, anal sex, oral sex, vaginal sex, masturbation, and scissoring.
This is my part, contraception. So there are a variety of contraceptions that are available. These are some of the external ones that can be done. Condoms, which also provided at the health center at no charge for students. A vasectomy, which is more of a permanent that at times can be reversed with some success. A vasectomy, that's mostly for males. There's the contraceptive patch, which is hormone-based. Also, there is ones that can be placed underneath the skin. And there's also injections that can also be used as a form of contraception. There's some other contraception here that is being shown that is usually ingested. Plan B is actually not always used, it shouldn't be used as a form of contraception. It should be used as a emergency only because it is hormone based. Birth control pills is what we've most commonly are used to, which are also available at the health center after speaking to a doctor and or a nurse, both for international students and for domestic students. There is also an intrauterine or an IUD. There are different types of IUDs that are used. There are hormone-based IUDs, and there's also ones that don't have any hormones that can be used. Injection is the other one that we have also talked about. Tubectomy is also known as a tubal ligation, and it's more of a permanent form of contraception that is used when they will either cauterize or clip the tubes of the female, which requires surgery and is much more invasive and not used for daily contraception. Birth control side effects. Because a lot of the birth control side effects that are used, either IUDs or the birth control injections, patches, all use a lot of the hormones. There is some side effects. You do need to see a doctor and a nurse because we also have to talk about your blood pressure, which is important to keep under control when you are using the hormonal side effect, hormonal birth control pills. There are spotting, some discharges, some mood changes that are all can be affected with the hormones that are available, but there are a lot of contraception that can be used that doesn't use hormones that some people have a better reaction to. IUD side effects, again, it depends on which type of IUD is used. And that's something that you would need to speak to either your GP or your nurse about. There is, if it's a hormone base, it's actually very similar to to the pill, except you don't have to take it every day. So it's good for people who have a hard time remembering to take their pills every day. And for people who don't want to use condoms. There's also, if you're using a copper IUD that does not have hormones, there is increase, sometimes longer periods with more bleeding, and some people are not always okay with that as well. So it depends on your best, what works best for your lifestyle.
And how do I know if I'm ready for sex? This is a really important thing to discuss. So some things to consider before having sex is, do I trust my partner? Will they engage in the kind of consensual, respectful sexual activity I want to have? Can I communicate openly with my partner? Do I feel ready to deal with possible outcomes of having sex? And do I know where and how to take care of myself if the sex I'm having results in pregnancy or an STI? So again, this is a really big decision, and it's really important to have these open conversations with your partner so you guys are both on the same page. And being sexually active is a matter of personal choice. There isn't a right age past the age of consent or a right time. And pregnancy. So a full-term pregnancy has 3 trimesters. 40 weeks or 280 days is the usual time frame. Full-term baby is born as early as 37 weeks or as late as 42 weeks. And a pregnancy starts from the first day of the last menstrual period and is counted from about 2 weeks before actual conception. So there's 3 trimesters. So the first trimester is 1 to 12 weeks. Second trimester is 13 to 28 weeks. And the third trimester is 29 to 40 weeks. And some people can also talk about a 4th trimester, which is a 3-month period post-delivery. And just a fun fact, the longest pregnancy ever recorded lasted for about 375 days, which is really long. Really long.
Yes.
And then what you experience in each trimester. So the first one, common symptoms are nausea, vomiting, cravings, heightened sense of smell, mood swings. Second trimester, bound ligament pains, nipple changes, stretch marks, and then you should start to feel the baby moving. And then third trimester, you feel the strong kicks from the baby. You can have swollen feet, back pain, leaking from the breast, frequent urination. Postpartum, you feel fatigue, soreness, leaking breast, and risk of postpartum depression. And again, if you have any of those symptoms, it's really important to talk to your family doctor. Less obvious symptoms would be moodiness, bloating, cramping, constipation, light spotting, feeling stuffy and having specific food cravings. And again, if you have any concerns, you can always reach out to the Student Health Center. We do pregnancy testing here, and you can also get in touch with one of our doctors to speak with them further as well.
Okay, so now that we've went through a lot right now, I think it's very important for us to discuss some of the most common sexually transmitted diseases and infections. The ones that we'll be speaking about today include syphilis, HPV, HIV, gonorrhea, chlamydia, herpes, and hepatitis. So let's get started. So syphilis is a sexually transmitted infection that is commonly caused by bacteria. It starts as a painless sore on the genitals, rectum, or mouth, and sometimes lead to a rash and more sores. Syphilis bacteria can stay on the body for decades before becoming active again. Early syphilis can be cured with penicillin. Without treatment, syphilis can cause serious damage to the brain, heart, and other organs.
HPV, also known as human papilloma virus. All right, so this is one of the most common. There are other common STIs, but this is one of the most common ones. It is passed through genital contact, and it's known as a sexually transmitted infection. Usually it's harmless. There are 2 different types, I believe. One is high risk and one is low risk. So if you have a low risk one, it's usually pretty harmless. It goes away in 1 to 2 years without any treatment. But if you have a serious or high risk HPV, it can lead to cancer or genital warts. Some signs of you having cancer or genital warts would probably be bleeding or pelvic pain or pain during sex.
So HIV, so it interferes with your body's ability to fight disease-causing organisms. People usually develop a flu-like illness with 1 or 2 months, within 1 or 2 months of contracting the virus. While there is no cure for HIV/AIDS, there are medications that dramatically slow its progression.
Gonorrhea and chlamydia, which is the next slide, they kind of go together, and they're very common and hang out together. So gonorrhea is usually caused by a bacteria. There is sometimes discharge from the penis, itching, burning, and more than half of women with gonorrhea don't have any symptoms, but can include burning, frequent urination, vaginal discharge, redness, and swelling. So if you're unsure, because those symptoms can be hiding other stuff as well, and are common for a lot of females, we want you to reach out to either a GP or a nurse. even at the health center, we do treatments. We do have the medications available for both gonorrhea and for chlamydia, which is treatable with antibiotics. But if it's left untreated, it can cause serious pelvic infections and the inability to reproduce. And you just keep on passing it to more and more people. And with the incidence of bacteria-resistant antibiotics increasing with our continued use of antibiotics, it's important to get treated as soon as possible and do the whole treatment that's required.
All right, let's go on to chlamydia. Chlamydia is a sexually transmitted infection, also caused by bacteria. Chlamydia is the most common STD in the United States and can cause scarring and damage to the female reproductive system if it's not treated early with any antibiotics, like Sandra has mentioned. Chlamydia often has no symptoms, but when they do occur, the female who get impacted with chlamydia, some of their symptoms include burning during urination, discharge, bleeding during intercourse, and for men, it's the symptoms can include pain during urination and watery discharge.
Herpes. All right, this is the most common one that I know, that I think is one of the most common ones. So it's caused by two different very similar bacteria. So the first one is herpes simplex virus type 1 and herpes simplex virus type 2. Both kind can be blistery sores showing up around your genitals or your mouth.
And hepatitis. So there's quite a few different types of subcategories for hepatitis, but it's an inflammation of the liver that can be caused by a group of viruses. So hepatitis A is oral fecal contact. Hepatitis B is contact with infected bodily fluids like semen, vaginal secretions, or blood. Hepatitis C is direct contact with blood. Hepatitis D and E is contact with contaminated water and is not thought to be sexual.
All right. So that concludes the information section of our presentation. Now, if you have any questions that may have arisen through the presentation, please send them to any of our presenters today through private chat. The first one I had received during the presentation. The slide deck for this presentation will be distributed after the event has concluded. As well, we are going to have the presentation recording available for asynchronous viewing very soon. So keep your eyes peeled onto some of our pages to see when that is available.
I have a question for the health nurses.
Yeah.
So do you give, is it the vaccine for HPV?
We do.
How does that?
So
It is offered. It is offered here. We do ask that you see either our nurse practitioner or the doctor. There's a charge for it. Just give me 1 second. Gardasil is $170.80, and you do need 3 doses of it. And it's done like there's a time frame for it, and each dose is $170.87. But yeah, we do provide it here. Some kids are getting it. They are offering it now in elementary schools. They're doing it in grade 7 for students now, and there's no charge for that. But anyone else, they do recommend that you do get it. Yeah, especially if you're sexually active. Yeah.
All right, I have a question in the chat. Is it covered by insurance?
Unfortunately, I don't think it is. You can, I don't think that even if you go to a doctor, like even with our OHIP cards, if you're an internet, you still have to pay for it. That's why now they've started doing it in schools, because they know it benefits students. Like hepatitis B, there's a charge for it if you're an adult having to do hepatitis B injection. But if you need, but they also offer hepatitis B through public health for certain ages. Like if you're a student, they like elementary student. Yeah.
I have a, oh, go ahead.
I have a question, and I was wondering if you can walk through the process of what it would be like for someone to get the birth control pills. What would that appointment look like? Setting it up. What is the kind of discussion that would go?
Your turn, Aisha.
So for the birth control, we would set you up with the doctor or the nurse practitioner, and they will just talk to you about like your lifestyle, what you're looking for, and tell you what the different types, if you want like an IUD, if you want the birth control pill, if you want the implant. And the implant is one of the new things that we came out with, it's the Nexoplan. I don't know if I'm pronouncing that right, but it's basically a device that you implant in your arm, in the bicep. So you can't see it, but you feel it, and that's good for 3 years. So they'll just go over the different types of contraceptions, and if you get the birth control pill, they'll write you the prescription. You can go fill it, and then we'll do like check-ins for blood pressures and weigh-ins. I don't know how often we do those, but I think before we do refills on the birth controls, you'll come in, see a nurse, talk to a nurse, make sure everything's okay. What side effects you're feeling, if you want to continue with it, take your blood pressure, your heart rate, and stuff like that.
Right. I have a question in the chat, and how long does it typically take to get the results for your STI test?
Within a few days, usually. If it's positive, if the gonorrhea and chlamydia are positive, they'll resend it. So that can take a little bit longer. But usually, if everything's negative, you get it back within the week, I would say.
Yeah.
Yeah.
HIV too, we do that here as well, the HIV testing. Yeah.
I just want to make sure that there is, if anybody has any more questions, or else we can move on.
I'm gonna ask another one.
Go for it, Raymond.
That was my personal question. Going back to the HPV, is there a age limit?
Nope.
Nope.
No.
No age limit.
So I can be 60 and get the
Yep. Yeah, they do recommend it for younger, but there is no age limit. Yeah.
All right. So that concludes our presentation for today. I would like to thank every one of you for joining us today. I would like to thank both Sandra and Aisha for joining us today from the Health Center and presenting with us today. If you are looking to meet with them at the Health Center, we have some information on the slide of where you can go and see them. At Davis, it's at C210 and that is their phone number over there. For HMC, it's A312, but also please note that the HMC Health Center is closed until next week. And for Trafalgar, it's at PB129. And like I said before, because I see the message in the chat, we will be distributing this slideshow following this presentation, and we will also have a recorded version of this presentation coming to you all very shortly. And with that being said, we can close out this event. Thank you for joining, and I hope you have a wonderful rest of your weeding week.